Omicron, the word that is sounding scary to many and has created a panic world over. And you know that why? Because WHO has given this name to the latest variety of COVID-19 virus, which is seen to be outbreaking majorly in South Africa as of now. And this video will help you know the latest that we know on this virus. So this variant was first reported to WHO from South Africa on 24th of November. And the latest Sunday report says that nationally in South Africa, the new infections have more than tripled in the past week, and the test positivity had shot up to 9% from just 2% earlier. So definitely the cases are rising at a rapid speed in South Africa. But the most concerning factor of this particular variant is the number of mutations, because reports suggest that it is having more than 30 plus mutations, and which is a number that has never been seen before. Experts do also add that the mutations would suggest that it would be more transmissible, and it might evade some of the protection of the monoclonal antibodies. And as of now, we don't even know that whether the present vaccines will be effective on this particular variant of the virus or not. So further study is needed. Taking a step ahead amidst concern on the detection and the transmissibility of this variant, WHO has designated, or rather labeled it as a variant of concern. As of now, it is not clear whether Omicron is more transmissible than the other variants that we have seen before, like the Delta. But this decision of labeling it as a variant of concern is on the evidence that Omicron has several mutations that may have an impact on how it behaves. For example, how easily it spreads, or what kind of a severity it could cause on the illness of the patient. So definitely there is a panic world over. Some of the global pharma companies have come up front and said that they are working on the vaccines of this virus, like Moderna, Pfizer and AstraZeneca, but experts have warned that it may take weeks to know how effective the vaccines are against the Omicron. The WHO has said that it is not yet clear whether the newly detected variant Omicron is more transmissible or causes more severe disease to the other variants, including the Delta variant that we have seen before. And there is currently no information to suggest that the symptoms associated are different from the other variants. The WHO as of now is urging caution after the two South African experts, including the doctor who first sounded the alarm of this particular variant and indicated that the symptoms so far from this variant are mild. So there is no concern on the severity as of now from the patients that we have of this particular variant, is that it is very severe, or rather the hospitalization rates are not that high as of now. The WHO further says that the preliminary evidence suggests that it may have an increased risk of reinfection with this particular virus as compared to the other variant, but the information on this one is also very limited. So definitely the cases are rising not only in South Africa but world over. We are seeing some of the other countries coming up with the announcement that they have detected this variant within their borders, and some of the other countries are even shutting their borders. So definitely there is a panic, but the information on how severe it could be, how vaccines are effective on this one, is very limited as of now. As per the data, the reports do suggest that the patients so far have really mild symptoms. So thankfully a breath of relief on that front, but definitely we should be having caution, and we should be taking the major vaccination and sanitation measures that we have been told from the past by the expert agencies. So that's the latest that we know on this particular virus variant.